Good morning. My name is Zamb. I'm a student nurse at Zamb&Ngina University. Today I'm here to do the postpartum assessment for Miss Mary. She just had birth. And we are going to talk about the plan of care with her and the goal of a plan of care with her. First of all, I will do my head hygiene. And I will put some gloves. Then I will enter the room. I'll make sure I put a privacy on. Then I will introduce myself to Miss Mary. Good morning, Miss Mary. My name is Zamb, and I'm a student at Zamb&Ngina University. Today, I'm gonna do. Can you please verify your name and date of birth? Okay, so I will check the patient ID. So the patient just give me a name and date of birth and make sure it's correct one on the bracelet. Cool. So I have the right patient. So today I'm here to do your postpartum assessment. And I'm gonna talk to you about the care the care plan and the goal of the care plan too. And I make sure the environment is safe before I start the assessment. So the environment is safe for the patient before I start the assessment. Then I will start by taking the patient set of vital sign. I make sure I take the patient temperature. I make sure I take the patient BP. I make sure I take the patient heart rate, respiratory, and the pain level. So the patient just told me that she got no pain, or she got no pain. That's good. Now we can start our assessment. I will assess the skin first. I will look at her skin. Miss Mary, I'm just gonna look at your skin. Okay, so your skin is pink. It's good color. I will try to feel check the temperature of the skin. So her skin is warm. Good. I check the color. I check the temperature is warm. I will check for the turgor. See the patient. See the patient is hydrated. I'm just gonna punch her skin and let it go. So the patient well hydrated. And I will check also for capillary refill. I'm just gonna punch on patient fingers, tips. I'm just gonna punch on patient fingernail, and let it go. So the capillary refill less than 30 seconds. So that's good. Now after I check the skin, and I will assess her breast. Miss Mary, I'm just gonna expose your breast so I can just assess it. Is it okay for me to assess your breast? Yes? Okay. I'm just gonna expose your breast. First of all, I'm just gonna look at the breast. So the breast is flat, inverted. The breast looks flat, inverted, and there's no sign of any trauma on both nipple. So I will check the temperature of the breast too. It's warm. I take my back of my hand. I'll check the temperature of the breast. So the breast is warm. Now I'm just gonna palpate your breast to make sure to look for any consistencies, any fullness. Fullness, that means your breast is full for milk. You're ready for the baby. Okay, so I'm just gonna palpate your breast to check for any consistency, for fullness. I will check also for the presence of cholesterol. So both the breasts are okay, so it's full, and there's the presence of cholesterol too. So the breast is ready for milk. So I'm just gonna cover the breast back up. Now I will check. I will start to assess the bowel movement. You know, Miss Mary, I'm gonna assess your your bowel. I'm just gonna ask Mary, when was your last bowel movement? So the patient told me like when was his last bowel movement. It was cool. Then I will listen to the bowel sound. I will listen to the bowel sound in four quarter, in all four quarter. I'm just gonna expose your abdomen so I can listen to the bowel sound. Is it okay, Mary? Is it okay? Cool. So the bowel sound is present in all four quadrant, and a bowel sound is present in all four quadrant, and it's very active. They are gonna check for any stomach abdomen distension. So since she just have baby, so I can see the presence of a distension in her stomach, but it will go down soon. Now it's time I'm gonna assess. Time for me to assess a bladder. I'm just gonna check for the voiding in the foley, and make sure the patient void 36 in more than 36 in hours. So I will check the foley bag. Okay, so I see that the patient has void more than 30 cc in 1 hour. So that's good. Now it's time for me to assess the patient with uterus. To assess the patient uterus, Miss Mary, I'm just gonna expose your stomach, like on your belly level, so I can just assess your uterus. So to assess the uterus, I'm just gonna put my hand on the belly level like that, and supporting to the bottom of the stomach. So the uterus is firm, midline, and at the umbilicus. The uterus is firm, midline, and at the umbilicus. That's good sign. Now I will assess. Now it's time for me to assess the patient uh, lochia. This one mostly I'm gonna ask the question to the patient to check the patient lochia. Ask her if what the color of lochia. If it's red, that's a good sign. Ask her if ask the patient if the patient weight no more than one pad an hour, so the lochia is red, and the sucking is not more than one pad an hour. That's good. And I will assess for the odor. So ask the patient if the lochia have an odor, any smell. The patient said no. Cool. And I will assess for if it ask the patient if there is presence of any clot on the lochia bigger. So he said no. So I'll make sure that if there is any clot, the clot not supposed to be bigger than a golf ball. So the lochia is looking good. It's red. The patient doesn't wait more than one part an hour. There's no odor. The patient told me there's no odor, and there's no presence of clot bigger than the golf ball. Now it's time for me to assess the patient perineal area. So I make sure I put the patient in lateral position. Miss Mary, I'm just gonna move in lateral position if you don't mind. I'm gonna move the patient lateral position. Move the patient lateral position. So we inspect for any redness. I look for any redness, any edema, any discharge. There's presence of discharge because the patient just give birth. So I assess for any redness. If the right is good. Any edema. There's no presence of edema. For discharge, a little bit discharge is good because the patient is a baby. Check for approximation too. I check for an approximation too, so it's good, cool. And take for approximation school, okay. So I can put the patient back down. Maybe I'm gonna push it back now. I'll put it back in your normal position. So I did check for the perineal area. I check for redness. I check for edema. I did check for any discharge, and I check for any approximation. And I did also what I would there. I'll check for any inflammation, and I checked for any hemorrhage. It wasn't sign of hemorrhage. It wasn't sign of any infection. Now I'm gonna move on to check to assess the patient lower extremity. So I'm gonna check the lower extremity. I'm gonna watch for the lower extremity color. So it's pink color. It's not pale, so that means it's well perfused. I will check the lower extremity temperature. It's warm. It's good. It's well perfused. I will check for pedal pulse. Yes, there's the presence of pedal pulse in both legs. Okay. Then I will check for any sign of edema. So there's no sign of any edema. No leg swallowing. That's good. So I will check for any sign of conus. I'm just gonna lift the knees like that. I'll check for any sign of conus on both legs. No sign of conus. No sign of conus. No sign of DTR. Now, this means I'm just gonna cover your leg. Now I will check whether I set the patient emotion. I saw the patient happy to have a baby. The patient is talking to the baby. The patient touching the baby. And her partner too, her partner too is engaged. Is engaged with the baby too. So that's a good sign. Now I will assess the cesarean. Start the cesarean. If it's on day one, Miss Mary, I'm just gonna look for your cesarean. Okay. So the cesarean dressing, it's dry, intact, and clean on day one. That's good. And on day two, when I come back, I will assess for the incision because there's no infection in incision, and I will listen to the bowel movement too in 4 quadrant. I listen to the bowel movement in 4 quadrant, and I will check the folate too. Make sure the folate has at least more than 36 in hours. So that's good. So that means the patient voiding very good. Now, after that, then I will go assess now any sign of warning, for any warning sign. I will assess for postpartum warning sign. So I will make sure I will ask the patient if they have any chest pain. Mary, do you have any chest pain? She said no. I will check if the patient have any obstruction, any respiratory obstruction, or I will check the patient have any respiratory obstruction. I will check if the patient have any sign of seizure, any sign of bleeding, any headache. I will also check if the patient have any temperature above 100.2. I will assess for any redness of any swelling of leg. So those signs gonna show me that the patient having postpartum complication. So that's so the patient doesn't have all those signs. That's good. Then now I will educate the patient before the patient go and make sure I educate the patient about how the patient gonna take his medication, what is routine medication. Miss Mary, you're gonna take a you will take a medication as being prescribed by the doctor. Don't stop it until the doctor asks you to stop it. You know, the regular symptom is just gonna be nausea, stuff like that, small. But if you taking medication as prescribed, you know, and just stop it when the provider asks you to. Thank you.